Now, a really significant development in the treatment of breast cancer. Around 100 women a year with advanced breast cancer will be able to try a new type of immunotherapy on the NHS. To explain more, Dr. Frankie Jackson-Spence is in the studio. Good morning to you. I know that you administer these types of drugs to other cancer patients. Just for anyone listening who thinks, immunotherapy, what is that? Can you just explain?
Yeah, so immunotherapy is a really novel type of cancer treatment, and we've had lots of developments in this area in the last sort of 10 years or so. Essentially, it's very different to chemotherapy. Chemotherapy is quite a generic drug which goes to kill the cancer cells. Immune therapy is entirely different. It looks the same in that it's given through a drip in the arm and it's an infusion, but actually it works by educating your own body's immune system to kill the cancer. So just like our immune system can identify a virus like the flu or COVID, and it can go and kill those viruses, your immune system actually has the capacity to kill a cancer cell. But cancer cells are very clever, and they develop these proteins on the surface that are almost like an invisible cloak. And what these immune therapy agents do is they go and attack that invisible cloak and make the cancer visible to your own immune system. So very cool science.
I want to be really clear, though, because we've sounded really optimistic, but this type of treatment is available for a very select group of people for whom they've already got a terminal diagnosis.
Yeah, so this type of immune therapy is going to be licensed for patients who have advanced breast cancer. So this is people whose cancers are already spread beyond the breast and that surgery isn't a suitable option.
So the drug isn't going to save your life, but it will prolong it.
Exactly. So the aim of the drug is to get in control of the cancer and stop it growing, and therefore improve outcomes for patients and prolong the length of life.
So it gives vital extra months to people at that really critical stage. Of course, what we really want as well is to prevent people getting there in the first place. Are women educated enough and then actually in practice doing the right type of checks to make sure they don't become one of those patients?
Absolutely. I think you've hit the nail on the head there. These drugs we're talking about are treating breast cancer at quite a late stage. I really want us to do work at preventing and picking up these cases at a much earlier stage. So I really want to kind of empower women to take control at a much earlier stage and start examining their breasts regularly. That is the single most important thing that women can do.
What's regularly?
So I would recommend checking your breasts once a month. I think anything more frequent than that actually can just induce anxiety.
Of course.
So once a month, and getting to know your own normal. I think people really have an anxiety around this because they think if we look, you might find. But I really can't emphasise enough that picking up these cancers at an earlier stage is critical to improving survival.
Frankie, thank you so much. Really appreciate your insight, Dr. Frankie Jackson-Spence, NHS doctor, talking to us there about this new treatment for people with breast cancer.